I'm Beckman, veterinary dentist. I'm here on behalf of veterinary medicine to talk about regional nerve blocks for oral surgery in dogs and cats and demonstrate them on a step-by-step basis. Prior to getting started with our step-by-step, I'd like to talk a little bit about the importance of nerve blocks from a patient safety standpoint. So when we talk about doing regional nerve blocks for our patients, we're talking not about going in and blocking the area that we're going to be working on directly. We're talking about blocking the nerve before it gets to the site that we're actually going to be working with. If we place a local anesthetic in our periodontal patients at the site of inflammation, that anesthetic is going to be much less active or not active at all, because these anesthetics work based on the pH of the tissue. And if the tissue is acid, they're not going to be as readily taken into the nerve itself as they are if the pH is what exists normally in a region where there is not inflammation. If we're able to totally block the sodium channels between our surgical site and the regions in the higher centers of the brain where they're normally perceived, we're able to maximize the physiologic parameters that we monitor during anesthesia. Those being respiration rate, heart rate, cardiac output, and blood pressure, among others. Maximizing these parameters also allows us to maximize tissue perfusion, which becomes extremely important when we have small patients whose surface area to body ratio are not particularly conducive to long anesthetic procedures. If we're allowed to block impulses from our surgical site, then we can maintain a patient at a level that's close to the equivalent that we would have that patient just for prophylaxis, maximizing patient safety. So let's get started. Okay, when we are doing the rostral maxillary blocker, for the most part, if we're doing any of these blocks, wherever the needle placement is and the agent is delivered, from that point forward, rostral to the midline, we're blocking soft tissue, tooth, and bone. So in the rostral maxillary block, the first thing that we're going to do is we're going to lift this lip up, and in so doing, we are retracting this infraorbital neurovascular bundle dorsally. And then we're going to place our needle underneath that and adjacent to the bone and direct it right back into the infraorbital foramen, just like that. If we don't experience any resistance, as we did not here, then we know we're in the foramen. If we experience resistance, that means we're not in the correct place and we need to back off and redirect in order to place it into the correct area. This will block the third premolar, rostral to the first incisor, the soft tissue adjacent to those teeth, and the bone that they're encased in. So that's the rostral maxillary block. The other maxillary block is the caudal maxillary block, and in order to perform that, we need to open the mouth a little bit wide and then retract back the commissure. And what we're attempting to do is just place this needle perpendicular to the plane of the palate, right behind that second molar, and a little bit beyond where the root, you would expect the roots to culminate at the apex. So we go up about maybe 4 to 6, maybe 7 millimeters, depending on the size of the patient, and we're placing that agent right at the infraorbital and pterygopalatine nerves before they start to branch. So that will get bone, tooth, and soft tissue from the caudal maxilla all the way to the first incisor, including the palatal mucosa, palatal bone, and the soft palate.
So that's the caudal maxillary block. So those. When performing our maxillary blocks, we need to take into consideration anatomical differences between the normal skull dog, or the mesocephalic or dolichocephalic skull conformation, and that of the brachycephalic dog and the cat. Take a look at the length of the infraorbital canal in this particular dog. The infraorbital canal starts here, it enters back into the pterygopalatine fossa area, which is here, and the length of that is about 2.5 centimeters. Contrast that to the brachycephalic dog, where in this instance the entrance to the infraorbital canal is here, and if we place our needle, it extends back to this point where we just entered the area adjacent to the pterygopalatine fossa, which is half the length, or about a centimeter or centimeter and a quarter in this particular skull conformation. The length of the infraorbital canal in the cat is even shorter in relation to the brachycephalic dog. If we place our needle just barely into the infraorbital canal, you can see that the tip now resides adjacent to the pterygopalatine fossa, right at the same region where we would place the caudal maxillary block for the normal skulled or dolichocephalic or mesocephalic skulled conformations in the dog. When we're looking at the mandible, we've got the rostral mandibular block. And the middle mental foramen is our target, and that mental foramen is about 1/3 of the way up from the ventral body to the marginal bone here, directly beneath that mesial root of the second premolar. So what we're going to do is we're going to place our needle rostral to the mandibular labial frenulum here, which I have retracted down with my finger, and we're going to direct that backward to and into that foramen. And again, we should be able to place it where we're not encountering bone. If we encounter bone, again, we need to back off and redirect it so that it does go right into that foramen as it has here. Now the way to test that, if we want to make sure that we're in, if we move that needle laterally, it's going to move the whole patient. If it's not in the correct spot, if it's outside, it will move the frenulum itself, as you see here. Now the last block we do is the caudal mandibular block, and in order to do this, we need to be able to palpate this little notch that is in the caudal mandible, just rostral to the musculature as it attaches to the bone. And that little notch also corresponds well with the lateral canthus of the eye. So in some cases we can't palpate that, especially in cats. Then we use the lateral canthus of the eye to drop a plumb line directly beneath the ventral mandible, and that's our target. So I like to approach this from somewhat of an angle by palpating the lingual aspect of the ventral mandible here, and then placing the needle so that it contacts the bone, and then redirecting it upwards slightly. And you only need to go in about maybe a half of a centimeter, 5-6 millimeters, in order to be in the correct spot. And what we're doing is we're blocking the inferior alveolar nerve prior to its entrance into the mandibular canal. So we're not actually hitting a foramen in this block, we're just placing the agent adjacent to that nerve before it enters the mandibular canal. This block will desensitize everything from the last molar all the way to the midline, bone, tooth, and soft tissue as described previously.